All right. Hello, everybody. How are you today? Hope everybody's doing okay. Um, so before I get started, did anybody have a chance to watch the video, the recording?
You can thumbs up or thumbs down, maybe.
Yeah.
Few.
Okay. Good. Yeah. Cool. I didn't know if anybody was gonna watch it or not. Good. So I hope it was useful. So in that video, I was really focused on communication, like internal to your organization, because I think that's a really hard thing. Because often if you're on the data side of things, data people are usually trying to do something different than what people who are more on the program side of things are trying to do, and that can cause lots of barriers in communication, and sometimes we don't realize it. And sometimes it causes problems, or we don't realize that we've miscommunicated, and that causes problems. So let's see, I'm gonna share my slides. So I have all of those slides, like all the slides are in the same slide deck, right? So like all of this is stuff that was in the video. Right. So you saw all that's stuff that was in the video. And then I just added on to that with these slides. So these were all posted in Teams. So you should be able to access these slides there. So what I'm talking about today while we're together is a little bit different than what was in the video. So in the video, I was focused on communicating within your organization. Today, I'm going to be talking more about communicating outside your organization, but with non-academic audiences. Right? I think in a lot of our training programs, we get pretty good information on how to communicate with academic audiences and what academic audiences expect to see and hear when we're presenting data. Right? They expect intro, methods, results, discussions, and conclusions, right? And because that's the way manuscripts are laid out, that's the way abstracts are laid out, and that's the way that most academic presentations are laid out. But non-academic audiences, most often that doesn't work that well because they're not used to seeing information presented that way. And they're usually not that excited about hearing a data presentation to begin with. So if you kind of lose them early in something that they're not excited about, then you're going to have a hard time being effective and having a hard time accomplishing what you want to accomplish with that presentation. So this is something that I've spent a lot of time thinking about and trying to work out and practicing and failing and getting a little bit better. And so I certainly don't profess to have all the answers. Right. Hopefully in this session, you'll get an opportunity to talk to each other about what's worked well for you and what hasn't worked well for you and what you think you might do differently going forward. And if you want to talk about any communication situations with me, I'm happy to talk to you about those at any time. Just send me an email and we can set that up. But again, I don't have all the answers. Right. There are some situations that are just hard situations. But in the videos, if you didn't see it, one of the things that we talked about is, on the program side, right, you have somebody that's super busy. On the analysis side, the data side, you have somebody that's just at their computer working away on the data, and the busy program administrator says, so what did the numbers tell us? And the analyst says, well, the numbers tell us that there's no statistically significant evidence of a positive linear trend between ice cream sales and property theft and the zip codes of interest. And that's the grad school interpretation of those statistical results. And then the administrator says, what? That doesn't make any sense to me. Can you clarify that? And the data person says, clarify it? Yes, I'd love to clarify it. Nobody ever asked me about my statistical methods and about my methods. So I'd be happy to clarify it, right? This is how I designed this analysis. This is the code that I wrote. This is how I did it to get those answers. And so this is hopefully kind of easy to see how this happens within an organization, but it happens with external partners as well. And within an organization even, it's not always easy to spot, right? As this kind of silly example, right? A lot of times it looks like this. Do we have delays in hospitals sending newborn screening blood spots to the state lab? And the answer is, across all hospitals, there was an average of 6 days between births and the state lab processing blood spot specimens, right? Is this answering, is this data answering this question? And it can be kind of hard to tell, right? The answer here is no, this data is not answering the question. But if this person doesn't understand that this isn't the answer that they're looking for, they can go on to make bad decisions, right? So talked about this a lot in the video. A lot of you have watched the video, so hopefully this is familiar and kind of bridging that. But you know, this same kind of thing applies when communicating to external audiences. So what I want to talk about today is some things that we can think about before putting together our communication tools to help us be better communicators. I want us to think about how people often receive new information and respond to that information, and thinking about that will hopefully make us better communicators. And then some things to think about when we're doing the communicating, when we're putting together our communication tools. And then we'll close out with a big finish, hopefully, if we have time. So before we get into that, right, this is a cartoon, two people walking through a wooded area. There's a lightning crash, boom, crack. One person says to the other, whoa, we should get inside. And the other person says, it's okay, lightning only kills about 45 Americans a year, so our chances of dying are only 1 in 7 million. Let's go on. And of course, the caption says the annual death rate among people who know that statistic is 1 in 6. Right? So as epidemiologists, this is what we call conditional risk, right? If you're outside in a lightning storm and you seek shelter, right? Say, let's go inside, your chances of dying are one thing, right? Maybe they're close to 1 in 7 million, right? If you are in a lightning storm and you decide, you know what, let's stay out here swinging these golf clubs, or let's stay out here swimming in this lake, or whatever you're doing, climbing this tree, right? Your chances of dying are not 1 in 7 million. Conditional on the decision to stay outside, your chances of dying are something very different. Probably not 1 in 6, but not 1 in 7 million. So in this cartoon, right, they have the right data, right? Only 45 Americans a year die of lightning strikes, right? So that's not wrong. Yeah, that's the right data. Our chances of dying are only 1 in 7 million. That's not wrong, but it's misunderstood, right? And you might say it's been miscommunicated. And if we're doing this, if we're miscommunicating like this, when we're trying to communicate data for populations, for programs, for policies that we care about, and that we got into public health and that we got into maternal and child health to try to make better, if we're miscommunicating about those, right, we have the right data, but we're miscommunicating it, kind of the best case scenario is that the data that we've miscommunicated or that someone has misunderstood, the best case scenario is that the data is exactly useless, that they don't use it to make a bad decision, right? Oftentimes what happens is somebody understands data wrong, often because it's been miscommunicated, and they make a bad decision with that data. And it makes the things that we care about, right? The people we care about, the programs that we care about, the policies that we care about, it can make things worse, right? It can do the opposite of what we're trying to do in our jobs, right? So this stuff is important. So some things to think about before putting together your communication tools, right? And by communication tools, I'm thinking like charts and graphs and tables, whatever you're going to use to communicate to your audience, right? Whether it's an audio-visual communication, whether it's more like a white paper where you're where people are just going to be consuming it kind of at their own speed, whatever it is. Some things to think about before you start to put that together. Stop doing stuff and think. All right. In our jobs, we feel like we're wasting time. Often, if we're not doing something. But thinking is doing something. Right. So stop doing stuff and think. If you've got to communicate something, you've got to think it through first. So in order to stop doing stuff and think, we need some physical space. Often, right? Like I need to go somewhere where I can be alone with my thoughts, and I can get up and walk around while I'm thinking if I need to, where I can talk to myself and I can call myself bad names if I have bad ideas, and I'm not self-conscious about doing that process, right? So I need some physical space. I need some mental space where I'm not distracted, right? I need to put away my phone. I need to turn off my email. I need to tell people that I'm, if I'm going to be here, where I'm going to be, but don't bother me because I'm going to be working on something and I really need to think about it. And then I need some blank space, right? I need some paper or a dry erase board, right? And I'm going to use a pencil and I'm going to sketch things out, right? I'm going to, write out my outline of how I want to communicate things. I'm going to scratch things out. I'm going to draw arrows. I'm going to write things on the side and in the margins. And it's going to be really messy, but it's a process. I'm going to draw pictures of the figures that I think might work well to communicate this. I'm going to draw the shells for the tables that I think are going to communicate this well, right? I need some blank space to try to work through this, right? So I need really 3 types of space. I need physical space, mental space, and blank space. And when I have those things, I need to think about what the main thing I'm trying to accomplish with my presentation is, right? And the main thing is to keep the main thing, right? Some wisdom from Stephen Covey. I need to think about what the main thing is for my presentation, right? What is the main thing or small set of things I'm trying to communicate? What's my overriding communication objective? Am I trying to communicate how smart I am? Is that the main thing I'm trying to communicate? I've seen lots of presentations, lots of data presentations where that's the only real communication objective that I can discern, is that the presenter wanted everybody in the room to know how smart they are. And sometimes they're just trying to be thorough and they feel like they need to present everything and all the steps, but it's not accessible to the audience. Sometimes I've seen people present like this, and I think that they're doing it on purpose because I think that they don't want people to ask them a bunch of questions, right? What they want to communicate is, I know this stuff a lot better than you do, so don't ask me about it, just do what I say. Right? I've seen presentations where I really think that was their objective. That was the main thing that they were trying to communicate. I try not to do that, but is the main thing that you want to communicate how smart you are or all the work that you've done, right? Some people put in all of the steps that they took to get to their result because they don't want to leave anything out, but really what they're showing is all the work they've done. They're not showing and communicating what really matters. Or are you trying to communicate all the answers, right? You don't want anybody to have questions. So you're trying to put everything you can in your presentation and go through it really quickly so that nobody's left with any questions at the end. You've answered all the potential questions. And usually if you're doing that and you're not leaving room for questions, you're probably putting too much in and you're oftentimes being confusing, right? I know when I try to provide all the answers, it usually does not go well. And I leave my audience confused and not knowing what the point of all of it was. So it's okay for my audience to have questions after I've finished talking. Sometimes, as we'll talk about in a little bit, sometimes that's the point of a presentation, is that I want to generate questions, especially to non-academic audiences. If really I'm trying to help them use the data to work through a process and figure out the best way forward for their program, it's going to generate a lot of questions, and that's good. It should generate a lot of questions, right? So my presentation doesn't have to give all the answers. Is the main thing I'm trying to communicate, is it only the positive results? Or is it only things that I know for certain, right? I don't want to present anything where there's uncertainty, because it might be wrong later on when we get more data and we come back to it. Or is the main thing I'm trying to communicate an honest presentation of a complicated or maybe complex and nuanced situation? Right? That's where I find myself a lot of the time is, this is kind of a messy situation. The data is not totally clear. There's some positive results. There's some statistical shoulder shrugs, right? That we don't really know if it's a conclusive result or not. It's a complicated situation. Thinking about Dr. Ocampo's presentation on Wednesday in the Cenefin cycle, maybe it's even a complex situation. But what I want to do is I want to present it well, so that I can accomplish what I want to accomplish with this presentation. So a lot of times the things that we're trying to present are messy and muddy, but that's okay. That just means it's even more important that we stop doing stuff and we think about how we want to go about our presentation. So in order to stop doing stuff and think about what we want to present, it's useful to think about what we want to say, right? What do I want to say to this audience? And maybe the situation is, I want to tell them that what they're doing is working, right? Maybe the situation is, they think that what they're doing is working, but the program that they're working on or the intervention could be a lot better, and I want to help them understand that. Right? Maybe that's what I want to say, is I want to help them advance this program, right? So I have to think about what I want to say. I have to think about what my data say and how confident I am in my data, right? I have to think about things like the data quality. If I'm using birth certificate data and I'm using pre-pregnancy diabetes, right? I know that the quality of that data is not great. Right? There are several studies, lots of studies out there about the quality of some of those medical conditions on the birth certificate that say that data is not of high quality, right? So if I'm using that data in my presentation, I'm not very confident in it, right? Because I have good reason to not be confident in it. I also need to think about the context of my data. Why was my data collected? Was it collected for research or for this particular type of research project? Right? If I'm using claims data, right, like Medicaid data, was that data collected for research purposes? No, not really. That data was collected to make sure that facilities get paid. Right? That's the reason that data was collected. I'm using it to try to answer perhaps a research question or a program evaluation type of question, but that's not why that data was collected. So I need to understand that context, because that influences how confident I am in what my data say. And then bias, some of the stuff that Dr. Kramer talked about last week. We need to try to understand the bias in our data and account for that bias as best we can, so that we know what our data say with confidence. And then once I know what I want to say and what my data say, right, do those things agree? Can I say what I want to say with the data that I have? And maybe the answer is yes, that's great. But maybe the answer is no, right? And then I need to prepare myself for this communication experience I'm going to have, because I'm going to need to say something that I don't feel as comfortable saying, right? And that means I'm going to need to spend more time thinking about my messaging, more time preparing my presentation, more time practicing my presentation, right? So that I can communicate these data effectively. because it's not what I really want to say, but it's what I should say. And then what does my audience want to hear? Right? Do they want to hear you're doing great, what you're doing is great, everything's wonderful, keep it up? Or do they want to hear, or are they frustrated, right? Are they feeling frustrated? We feel like we're working so hard and I just don't know if it's working. I want to know if it's working, and if it's not, I want to know what we can do better, right? Is that what my audience wants to hear? So when I think about these three things, I can think about, are all three of these the same thing, right? Do I want to say that things are going great and the data indicate that things are really going well, and my audience wants to hear they're going great? Wow, that's going to be a fun presentation. You know, that may be an easy presentation to give. But if I want to say that things are going great, my audience wants to hear that things are going great, but the data don't say that, that's going to influence how I prepare for my presentation. It's also going to influence how I package my presentation, because I know this isn't what the audience wants to hear, right? So I'm going to need to do perhaps some more stage setting, explaining the context a little bit more, explaining what we want the end result to be in my presentation, right? So thinking about these things, it takes time, it takes work, it takes thought, right? For me, it takes that physical space, the mental space, and the blank space to try to think through some of these things. But taking the time to think about these things almost always makes my presentations better, right? And sometimes this is easier with academic audiences because we know that they just want to hear the results in the conclusions, right? And they're not as invested in what those results and conclusions are. If I'm presenting to a program audience and they're really invested in this program and they have something that they really want to hear, that should influence the way I put together my presentation. But it can't if I don't take the time to stop and think these things through. For that reason, I need to think about, who is my audience, right? What's their background? What's their experience? What are their professional functions? What are their challenges? Am I speaking to a really diverse audience, right? Sometimes I'm speaking to a group that includes, people that work in the programs, people that are healthcare providers, people that work in, say, social work, people that are clergy in different faith communities, and people that are policymakers, right? That's a big, diverse audience. That influences how I'm going to put together my presentation, and I've got to wrestle with that. I've got to think through it, right? There's not an easy flowchart or framework to follow to put this together. It's stuff I've got to stop and think about, right? Maybe I need to talk and listen to some people. I need to talk to people who know this audience a little bit better and see what they say. I need to bounce my approach and my ideas off of them to see what they have to say, to see if this approach might resonate with this audience. Sometimes talking to somebody else and having to explain the results in a low stakes environment to somebody else can help me go back to my outline and totally redo my outline, because I've thought about how to explain it to somebody that's not as involved in it as I am, but knows my audience really well, right? So getting the space, stopping and thinking, talking and listening, these are all important. Once I've thought through those things, it's useful to think about the purpose of my communication, right? What am I trying to do? Am I trying to confirm, educate, or explore, or something else? These are the things that I want to talk about: confirm, educate, or explore. So confirm, usually I'm answering questions, right? I'm not, I may generate a few questions with my presentation, but a lot of times I'm answering questions. And if the answer to those previous questions, right, if the answer to all these are in agreement, right, what I want to say, I want to give them good news, my data have good news, they want to hear good news, right, then I'm trying to confirm, right? I'm just trying to answer their questions. I'm trying to validate what they want. I'm telling a story, right? I'm telling the story that they want to hear. So as a quick example, I want to talk about a program evaluation that I was working on that was aiming to reduce preterm birth, low birth weight, and NICU admissions, right? And I was presenting to the funders of this program, right? It was funded by multiple agencies and nonprofits across the state, and they've been putting money into it. They wanted it to work, right? And I wanted it to work, right? Because it was trying to serve populations that I care about. I wanted it to work. I wanted to give them good news. The data analysis that I did was somewhat complicated. I linked birth certificate data and Medicaid data and social services data to look at all these things. I used propensity score matching to create a comparison group. I was using robust standard errors in my analysis of the outcomes because I was using matched data. So my treatment and control groups were non-independent. So it was important that I use robust standard errors, right? So the statistical methods that I'm using are somewhat complicated, but that doesn't mean that my presentation need to be complicated. Right, what I was able to present was we have these two groups. We have the program participants, and then we have people that were eligible for the program but did not participate, right? So this is my unmatched comparison group, and I'm looking at them on a host of risk factors and characteristics like mother's race, mother's education, mother's age. And what I see here is that the distributions in my program group are not the same and not even really close to the distributions in my group of people that didn't participate in the program, right? They were eligible but didn't participate. And I see that all the way down the line of my characteristics. So what I want to do is I want to compare these program participants to a group of these people who are eligible that didn't participate, a group that is as similar to my participants as I can get. So I used a process called propensity score matching to get this matched comparison group. And I can see here that these distributions are very similar now. Right, so now my program participants are similar to my comparison group on all these different factors, right? These three, and then I can show the rest. And that's what I want. I want my participants to be as similar as possible to the people that I'm comparing them to. And then I want to compare the outcomes between these two similar groups to see if those outcomes are different. And when I look at our outcomes that we're interested in, preterm birth, low birth weight, and NICU admission, I see that preterm birth was reduced in the program group from 13.2% in the comparison group to 9.9%, right? That seems to me to be a very meaningful reduction. Low birth weight in my participant group was 10.7% compared to 12.6% in the similar comparison group. Now my NICU admission, my p-value is not statistically significant here, but 7.7 compared to 9.6%. Maybe that is meaningful if we can expand this program to a larger scale. Maybe that's meaningful, right? I don't need to go in depth on my statistical methods. I don't need to talk about my robust standard errors that I use to calculate these p-values, because this audience didn't care about any of that, right? I was the statistician and epidemiologist. They trusted me that I was going to do this right. And I was able to just use these results to tell that story. And it was, of course, they were happy to get these results, and I was happy to give them these results, right? So that was kind of an easy one. I was just confirming what they wanted. I was telling them a story. Sometimes the purpose of our data communication is to educate our audience, right? Or to help them make a decision. And in this situation, I'm not thinking about as much that I'm telling them a story as much as I'm teaching, right? I'm trying to help them understand what the data say and what the implications of these data are. And so Another program evaluation that I've been involved in is of a statewide contraceptive access initiative. And they wanted to make sure that the IUDs and implants, which are historically the hardest methods to access, especially among low-income populations, are available in publicly funded family planning clinics. So we're talking about health department family planning clinics and federally qualified health center clinics that offer family planning services. And so what they want to know is, does focusing on increasing the inventory, right, making sure that they have IUDs and implants in stock, does that result to increased utilization of IUDs and implants, right? So the question is, do patients want IUDs and implants but can't get them because they're not in stock? And so they put a lot of resources, right? They're working with all the health department clinics, a whole bunch of like 90 FQHC clinics across the state. They're trying to get them to increase their inventory. And so what does the data tell us, right? So DHEC Department of Health and Environmental Control, that's the health department system. FQHC, these are the federally qualified health centers. So almost all health department clinics were stockpiling implants and IUDs, right? 40% of FQHCs were stockpiling implants and 27% were stockpiling IUDs. So they had an inventory of these contraceptive methods in almost all the health department clinics, but not almost all of the FQHC clinics, right? And using some of the measures of association from Dr. Kramer's lectures last week, right, we can look at the prevalence differences for implants. This is this 97% minus 40%. That difference is a 57 percentage point difference in the prevalence of health departments that stockpile implants compared to the prevalence of FQHC stockpiling implants. And even larger difference for the IUDs, right? 97 minus 27 is a 70 percentage point difference. We could also divide these two prevalences. 97 divided by 40 is 2.4, right? So this bar is 2.4 times higher than this bar. The prevalence of stockpiling implants is 2.4 times greater in health department clinics than it is in FQHC clinics. And it's 3.6 times greater in health department clinics for stockpiling IUDs than it is in FQHC clinics. All right, so we have health department clinics are 2.4 times more likely to stock implants and 3.6 times more likely to stock IUDs than FQHC clinics. So if this is working the way the program thinks it should be working, women who go to health departments, patients who go to health departments, should be much more likely to use implants and IUDs than patients that go to FQHCs. When we look at the utilization numbers, first of all, the utilization numbers are really low for IUDs and implants no matter what. And 4% compared to 3%, 8% compared to 5%, maybe they're not all that much higher for health department clinics compared to FQHCs. And this isn't the message that they want to hear, but I want them to be able to understand that, and this is going to generate questions. Right? And these are questions that it's helpful for the program to be able to ask, because what they want is to be effective. They want to understand, is this lack of utilization, is it because these patients just don't want these methods? And if that's the case, great, that's fine. We want to make them available. And if the patients want other methods, cool. But if the patients do want these methods and just having them in stock isn't doing everything to help these patients access these methods, then we need to think about this program a little bit more deeply. We need to use our partnerships that we've developed with the health departments and the FQHC clinics in a different way, right? And so in that scenario, I'm trying to educate with that presentation, trying to help this program make a decision that what we're doing is not working. We need to think about some other things. And then a third purpose for data communication could be to explore. And that's really a bit of both, right? That could be telling a story and teaching. Sometimes it looks like telling a story about the why, right? Why do we care about this? and then teaching about what we know and what we're learning. And so I'll use a continuation of that same example to talk about exploring, because sometimes if we have a situation where I'm giving one presentation and it's educating, right? This isn't working. And it creates some questions. And then they want to know, all right, well, what else can we learn from the data to know what might not be working, right? What is misfiring here? Or is it just that patients don't want to utilize these methods? What else can we learn from the data? So, this is the situation that we have. The health department clinics are more likely to stock both IUDs and implants, but we don't see a big difference in utilization. And when we continue to look at the data, right, we're just exploring. I want this type of presentation to generate a lot of questions, right? That's kind of the purpose. I want people to be thinking about these data. I want these data to spur questions that we might, and new plans that we might try. So when we look at the data, the percent of the clinics that are providing IUD insertion on the same day, right? They have them in stock in the health department, but only 30% of clinics can always or often provide them on the same day, right? So a patient comes in, they say, I want an IUD, and the provider says, that's great. We'll have to schedule a follow-up appointment for next week to get that IUD, right? That's not, maybe that's what's not working here. And it's even fewer in FQHCs, right? 11% can always or often provide an IUD on the same day. So maybe that's influencing this utilization number. Maybe patients do want it, but I have a job where it's pretty easy for me to take time off to go to the doctor, right? And even for me, right, I have reliable transportation to go to the doctor. Even for me, that's a pretty big inconvenience to have to make 2 appointments, right? That could influence my decision making. Much less if transportation's a problem, if taking time off work's a problem, if finding childcare is a problem, right? So this could have a big impact on these data that we're seeing. And then we also looked at the percent of clinics that agreed or disagreed that they had sufficient clinical staffing to meet the family planning needs of the population they were trying to serve. And just over half of the health department clinics said that they agreed or strongly agreed that they had enough clinical staffing. Almost half did not think that they had enough clinical staffing to meet the need, right? FQHCs, almost 90% thought that they had enough clinical staffing to meet the need. So these data can help us think about what we need to do. Maybe we need to tailor things a little bit differently for FQHCs and health department clinics, right? Maybe health department clinics need staffing support, and FQHC clinics need that stockpile because they don't have it, and they need some training support to be able to have the resources to provide these contraceptive methods on the same day. Or maybe we need even more information before developing a new plan, right? So if I'm exploring here, I'm trying to generate a lot of questions. I'm not trying to answer questions, right? We're trying to get a better understanding of what's going on, right? So I hope that you can see situations where having a purpose to confirm would be more useful than having a purpose to explore, or having a purpose to educate could be more useful than having a purpose to confirm. But the point is that all of these data communication efforts would look different, right? I would take a different approach in all of these situations, right? So what I don't want is to have, one set of slides or one report that I try to use in all situations to communicate about this data. Right? Because my audience is different, what I'm trying to accomplish is different, the purpose of my communication is different in different situations. So again, to recap this a little bit, it's really important to stop and think. I got to stop doing stuff for a little while and think. And I need space to stop and think. And I need to recognize that it's not a waste of my time to stop and think, because I'm going to be able to be much more effective at doing what I'm supposed to do in my job. If I can take the physical space, the mental space, and the blank space to think. Right? If I stop and think about the main thing, right? I need to understand what I want to communicate, what my audience wants to hear, and what my data say. And then how do I communicate this main thing that I need to communicate given these factors, what I want, what my audience wants, what my data say. And based on this, I need to think about my communication purpose. Am I trying to confirm, educate, or explore? And all these things I need to do before I start making my slides, or before I start making my final charts and graphs, or my final tables, or my final white paper, or fact sheet, or whatever, right? Whatever my communication tool is. I've got to stop and think about these things. It's going to make me a much better communicator. Maybe it feels like a waste of time, but I promise it's not. All right. Does that stuff make sense? Is that useful? Questions about this stuff? I do see one thing in the chat. There was a similar issue here, and it was determined because they were requiring several visits to get an IUD inserted. Yeah, I believe it was 3 visits. Unsure if it ever got resolved. Yeah, I mean, as you saw, that's what our data showed too, and that was a that was a problem, but nobody could do anything about that problem until we understood that this is a problem. All right, so I want to keep going a little bit more, and then we're going to go into some breakout rooms. I just wanted to do a quick check-in there. All right, so what I want to think about next, before I even start making my presentation, my communication tools, is I want to think about how do people often receive new information. And there is certainly an emotional component and a rational component to receiving new information, right? Everybody has, when we hear something new, right, we instantly know if we like it or not based on how it makes us feel, and we can also think through it, right? So Plato used an illustration of a charioteer trying to move his chariot forward or her chariot forward, but it was being pulled by one trained horse and one unruly horse, right? The unruly horse was the emotional side, and the trained horse is the rational side, right? And so they're kind of trying to work equally, and the charioteer is trying to make decisions and trying to make progress using both the unruly horse and the trained horse. The psychologist Jonathan Haidt, psychologist at New York University, uses an analogy of the elephant and the rider. So Haidt's research that he's done on this topic indicate that the emotional response and our emotional decision-making is much more powerful than our rational decision-making. So the emotional part of our decision-making in this illustration is like the elephant, right? And so you've got this 4-ton elephant, and you've got this, 100-pound, 150, 200-pound rider sitting on top of the elephant trying to control, and that's the rational part of our thinking and our reaction, our decision-making, trying to control this 4-ton elephant and which way that elephant's going to go. And so the elephant is going to have a reaction, and it's going to be a big reaction, and it's going to start going either toward the information because it likes it, or away from the information because it doesn't like it. And maybe if it's going away from the information, maybe the rider can convince or goad the elephant to turn around and go toward the information. But that's going to be tough. right? So, and I don't know which is right? If it's more equal parts, like Plato's illustration, or if it's more unequal parts, right, where the emotion is much bigger than the rational part. But it's probably a continuum, and it's different for different people. But no matter what, like there's a major emotional component to taking in new information. And we have to recognize this, right? If we're going to be presenting and communicating data, right, we're appealing to the trained horse, or we're appealing to the rider. And we're not appealing at all to the elephant or the untrained horse, right? Because we're trying to present a very rational case when we're presenting data. We could be totally unconvincing, even with the best data. And I think that we see this a lot in public health. I think that we see this a lot with data communication, that we want to present the data and we want to do a good job presenting the data, but we feel like the data should be pretty compelling because it's darn compelling to us because we spent 100 hours working to produce these results. And this is where a storytelling framework can be so helpful, because stories intuitively appeal to our emotional decision making, right? Our emotional reaction to things, and that's why I think that storytelling is such a good framework for trying to do public health communication, because like this stuff is hard, right? Communicating data is hard, and if we're only trying to do that hard part to part of somebody's mind, right? Part of somebody's decision-making, part of somebody's receptiveness to the information, it's even harder. But if we can use a storytelling framework, then maybe that makes us better communicators. I do want to acknowledge that that this psychologist, Jonathan Haidt, he has written some controversial stuffs, right? So don't, I'm not saying that this elephant in the rider thing is right, but I think that it's a useful illustration for us to think about when we're thinking about how people receive information and how people make decisions. So, think about, do you know your audience elephants? Are they going to be inclined to agree with what you're saying, or are they going to be inclined to recoil and run away from what you're saying? Because that really matters. And that matters in the way that I'm going to put together my presentation, right? Data is great for a lot of things. It's great for pursuing funding because grant reviewers are looking for the data, right? They already want to fund something in this area, right? So their elephant's already running this way, and we just need the data, right? The rational part to convince them. Scientific audiences love the data, right? But stories change policies and programs, right? When I was working in South Carolina, we wanted to get a law passed related to screening for critical congenital heart defects, right? Other states were passing laws. We had a lot of data showing that this could be useful. But it wasn't until a family came along and started advocating for an effort like this because they lost their daughter named Emerson Rose to a critical congenital heart defect that could have been detected before she was discharged from the hospital. So in South Carolina, we have the Emerson Rose Act, right, named in her honor, that created our critical congenital heart defects screening program. And it, like, that story is what drove that policy, right? That it's so compelling. And that's why we have programs like the Ryan White program. That's why we have Amber Alerts. That's why they're named after people, because these stories matter. These stories are compelling. If we have the data and the story, that can be really effective. it can be so effective that it can be good for misleading people too, right? News opinion shows are really good at that, right? Pairing stories and data to trigger a response that, sometimes it's toward, good things and good policy and things like that, but sometimes it's not. But it's very effective. It's very effective pairing stories and data. So it's useful to think about the capacity within within yourself, within your programs, within your colleagues that you work with for doing mixed methods research, right? And so that's using quantitative and qualitative data together to try to make a clearer picture, right? So mixed methods, as a quick aside about mixed methods, it's not just having quantitative and qualitative data. It's using them together to tell a story more accurately and more fully, right? So the quantitative data can help set up the issue in a really broad sense, right? Like, for example, with prenatal care, right? We have these disparities in prenatal care utilization, but then if we have qualitative data where people can share their stories about the quality of prenatal care that they're receiving, and we see differences in people's stories about, yeah, I was able to get prenatal care, but I was rushed through, compared to, yeah, I was able to get prenatal care, but I don't think they even listened to me, compared to, yeah, I got prenatal care and I loved it, right? Or I couldn't get prenatal care because this or that, right? So using these together, we can use the qualitative data to add richness and context and explanation to the quantitative data, or we can go the other way, right? We can use the qualitative data to help us develop our survey instruments, for example, so that we're asking the right questions in our surveys. Right? We can use the qualitative data to help inform our quantitative data collection, right? And that's a good use of mixed methods too. Mixed methods and qualitative data especially can also be really useful to make sure that small groups are included and represented, right? Sometimes we have groups that just get othered in our data, in our data analyses, right? They just get the numbers are small and we just group them together in this other category that's not really useful for anything except for not losing sample size. Sometimes we can use mixed methods and we can use qualitative data to give those groups a voice, right? To say these groups aren't invisible. They don't show up in this quantitative data, but this is what they're saying about their experiences, right? Sometimes our qualitative data can provide insights and expertise and context and impacts around disparities and other difficult issues to measure quantitatively, right? Like quality of services, like I mentioned about prenatal care. It's just hard to measure that quantitatively. It's hard to measure racism quantitatively, right? But using qualitative data can help us tell a story about the impacts of racism better. It can also help us design our surveys that we're using to ask questions that tap into racism better than the questions that we have now. But mixed methods research is hard. It's time consuming, right? It takes expertise that often, if we're working in epidemiology, that we weren't trained in, right? These things are just hard to do. So partnering with a qualitative expert is awesome. If you have the opportunity to do that, partnering with somebody that really knows what they're doing with qualitative data collection and qualitative data analysis is, I cannot recommend it highly enough. I have, in the past 5 years or so, have been working closely with some folks that are really good qualitative researchers, and it's expanded my perspective. It's made me a much better epidemiologist. if you don't have access or to someone who has a lot of expertise in qualitative data collection and analysis, or if you just want to build your skills in this area, just some places to get started. These 3 papers are available on Teams in the file section for this data communication section. But this one just gives a brief overview of qualitative methods for health services research. A lot of the stuff that I do is health services types of research. It uses a method called qualitative description, and it describes that method. It's a little bit less intense. It's a lot less intensive than some of the other methods like grounded theory and thematic analysis and things like that. So it's worth reading through and thinking about how you might be able to use that because it doesn't require as much specific training, but maybe you can get some good things out of qualitative data that way. This matrix analysis, this paper presents it as a component of a qualitative analysis, but we use that a lot in our research center. And I think that it's really insightful and enlightening using this matrix analysis technique. And then there's a lot of really good information in this EIS EPI field manual on collecting and analyzing qualitative data. So I've linked to it here because it's a CDC website. So that's my big plug for using mixed methods in qualitative research along with your quantitative data, because I think it can be really helpful. Okay. So I want you to be able to talk to each other about your experiences trying to communicate data. What experiences have you had that were successful and worked really well? What experiences have you had that did not go well? What were some important factors in your successes and failures? All right, and we don't need to come back and report out on this. I just want you to talk about it. I want you to talk to each other about it. And so let's take 15 minutes and talk about that in some breakout groups. Ashley, can you help us do that?
Yes, I will. It's going.
And while Ashley's doing that, so is this helpful, thinking about the emotional and the rational pieces of receiving information? As epidemiologists, we often just think about the rational part and just think about the data. And I think that limits our effectiveness in our communication in so many ways. And I think not learning about qualitative stuff, I think it limits us too. So, all right.
Okay, so we'll have 8 breakout rooms and they'll be assigned automatically. Rooms are open, so you should be able to join those, and we'll see you in about 15 minutes.
Thank you, everybody, for coming back. How was that? Was it useful to talk about stuff, talk about your experiences with some folks? I see some thumbs up. Good, good. All right, so it's hopefully useful to hear about some stuff, hopefully useful to talk about some stuff. Good. So I've got, in my time, it's 3:19. So let's take a 6-minute break, because it's also important not just to listen and talk, but it's also important to take breaks. Let's take a 6-minute break, get up and walk around, maintain personal water balance of whatever you need to do during this 6-minute break. So let's come back at, now it's 3:20. Let's come back at 3:26. Let's keep it 6 minutes. All right, start making your way back. If you're not back at your spot yet. All right, here we go. All right, so I hope that was useful, just to chat with each other a little bit about some of these things. All right, so now let's talk about some tools for communicating data, right? Like if we're gonna make tables and charts and stuff, let's talk about some tools. So this is a another cartoon of two people talking. One says to the other, I think we should give it another shot. And the other says, I think we should break up, and I can prove it, and shows a chart of our relationship, and it's obviously trending down. And the first person says, huh, maybe you're right. And the second person says, I knew that data would convince you. And then the first person says, no, I just think I can do better than somebody who doesn't label their axes. Right? So the way that we communicate data for making charts and graphs, that matters. And setting them up such that they're good communication tools, right? It's important to give some thought and some intentionality to the way that we set these things up. So let's talk about tables and figures and using them for communication. So tables can be really useful if you're trying to teach something or if you're telling a story, right? The measures of association and the measures of impact in a table can really help you highlight the key points of the story that you're trying to tell. But a lot of people use charts and graphs because we process information much more quickly with visuals than we do with text and tables. That can be good and bad, but as soon as we see a visual, right, in our minds, we start to tell ourselves stories about what we're seeing. And so here is a visual from one of the same websites that Michael Kramer pulled from last week. And so take a minute to take this in and then tell me what you think about it. Like what story do you start to tell yourself about these data? Somebody tell me.
This is a bit taller. Without reading the labels, I would have thought that the people who died by falling down the stairs were higher than the Apple iPhone sales. So it could be very miscommunicated. Like it could be very confusing at first without reading the labels really well.
Yeah. Yeah, and some people are saying in the chats that people are so busy looking at their phone screens that they're falling down the stairs, right? And that's kind of like, that's a pretty easy story to tell yourself when you see these data. And you can say, oh, I could, like you want to make sense of the data that you're seeing, and it's easy to make sense of these data. But when you look at the scales here, you can tell this is really just a trick of the scales, right? From 1,900 to 2,000, right? The scale here for the deaths is just 100. And then the scale here for iPhone sales is from 0 to 40 million. And it's really just a trick of making the scales match up to make these look like they're correlated. And they're correlated, but they're certainly not, I don't think that there's a causality here. So data visualization, right? Making charts and graphs, it's kind of like music, right? You don't need to know music's theory to know what you like to listen to. If you're a consumer of charts and graphs, you know what you like to see and you know what's easy for you to interpret. But if you're going to produce good music, some training in music theory is usually pretty important, right? So if you're going to produce good charts, graphs, data visualizations, spending some time thinking about what works well and what doesn't work well, and what is, what resonates and what doesn't resonate, how people see charts and graphs is really useful. So let's look at and think about how people view and read charts and graphs. So I'm going to put a chart on the screen, and I'm going to be quiet. I want you to look at it and figure out what it means, but I want you to be conscious of how you're doing that. I want you to be conscious of what you're looking at first and what you're looking at next to try to make sense of this chart. All right, here we go. So when I see this chart for the first time, right, the first thing that I notice, and it's not the same for everybody, but the first thing that I notice is I've got two lines that are crossing, right? And one line is rural, one line is urban. Okay, now I got to figure out what this means. What's the context? And I look at that, where do people live, percentage of the world, populations living in urban and rural areas. Okay, so this is percentage up there, and then these are years. So rural, as years go on, the percentage of people living in rural areas is decreasing, while percentage of people living in urban areas is increasing. They cross in, you know, a little before 2010, and oh, these years haven't happened yet, right? So there's some projection going on here, right? And so that's kind of the way that I look through this, and think about it, right? Did anybody else have a similar path to finding meaning in this chart? All right, Kauai, top to bottom. Green color first. Right, some of you probably did go, as Kauai said, right, top to bottom, left to right, the way that we would normally read something. A lot of people don't. A lot of people didn't go top to bottom, left to right, right? First notice the intersection. Yeah, me too. The first thing that I notice is the intersection, and then the green line, and then the labels. Yeah, assume the main message was about rural decrease. And maybe that is the main message, right? If we're presenting that. But not everybody looked at this the same way. So the point is, every time we see a chart, do we go in order, left to right, top to bottom? Is that what everybody does? Is that the way we always take in a chart? No, and everybody doesn't do it the same way. Right? So if we're going to make a chart, we have to recognize that we put the title at the top, but not everybody's going to start at the title. Right? The title is important, but not everybody's going to start there. We don't always read charts in order. And what do we see first? What stands out? Right? Some people see the green line first. Some people see that these lines cross first. Right? What do we see first in this one? What do you see first in this chart? What stands out to you? The peak. Yep, the blue line. Anything about the blue line? Like, do you just see the whole thing, or does something draw your attention about it? Yeah, this dotted demarcation. Yeah, the sharp drop in the trend line. Week 2 is longer than a week. Yeah. Yeah, color shade, peak, axis, week, then title. So most people's eyes are drawn to change, right? So a lot of times what people will see first is a peak or a valley or a decrease, right? Or something that's dividing the chart, right? So these are things that draw our attention. And if our story is not about this peak here, or this drop, and then this other smaller peak, if that's distracting from our main message, but that's one of the first things that people are seeing, then that's a problem, right? Maybe we need to present this chart without that in the background, or present it that way first, and then add this background distribution for the peak, right? But our eyes, we don't always start at the top, and we don't always go top to bottom, left to right. Usually things like peaks, valleys, drops, these demarcation lines, those are things that draw our attention first, right? So that's useful to know if we're going to be putting together charts and graphs for the purposes of communication, right? We want to use that to our advantage. If the main thing is talking about this peak, then we want people's eyes to be drawn to that. If the main thing is talking about this decrease, maybe we want to get rid of that background data and get rid of this second axis and focus on that first, right? If our main thing we want to communicate is this outage and that then there's a delay and then there's a decrease, right? Maybe we want to have that there. If we don't want to communicate about that outage, then maybe we want to take that out, right? But knowing what people are going to be drawn to in our figures, even if not everybody's drawn to the same thing, right? Knowing what people tend to be drawn to can be helpful. Another thing to think about is we only see a few things at once, right? And then the more data we see, the more we can only focus on the big picture trends. So the more singular the chart's meaning becomes. It's a little bit counterintuitive. If we have a lot on there, if we put a lot on the chart, then everything kind of loses its individual meaning. And what we see is just kind of a big picture story. Right, so Nika's talking about dashboards are fun, right? Because it's a lot of different charts to look at and try to figure out all at once, right? And so, that's taxing. So as we add things to our charts and our figures, the individual meaning starts to fade and we start to get more towards our charts having a blurry meaning, right? So this is looking at the correlation between the average percent of families in poverty in a state and the average teen birth rate in a state, right? And so each of these dots is a different state, right? Each of these different states doesn't mean much. It doesn't have much meaning, right? The big picture takeaway, what does have meaning is that as this goes up, right? As average poverty goes up, average teen birth rate goes up. And that's kind of the meaning that people are going to take away from this chart. And they're going to start to tell themselves stories about this, about why this makes sense, right? So I need to understand that and recognize that too, because if this leads to people thinking about a story or an association between these things that's value laden or whatever that I'm not intending to get across, I need to think about the way that I'm communicating with this chart and what this chart is communicating, right? Because people aren't focusing on states or grouping states together or anything like that. Showing a lot of data on one chart isn't always bad, but a lot of time, usually we can only process these things at what I call the blurry level, right? The big picture, not focusing on the details, right? So in this chart, I have the trend in the average teen birth rate for 4 different states, right? And I have North Carolina, Georgia, Tennessee, and Kentucky. The teen birth rate is highest in Kentucky, lowest in North Carolina. They're all decreasing at about the same rate. Okay, if the point of my communication is about how do Tennessee births compared to other states, right? Tennessee teen births compared to other states, maybe this isn't quite that clear. Maybe if I make all the other states a different color and kind of fade into the background, maybe the point I'm trying to make about the Tennessee teen birth rate isn't all that different. The decrease in the Tennessee teen birth rate isn't all that different than the decrease in some of these neighboring states. Maybe it gets more clear this way, right? Because people are going to be drawn to this color that's more darker and more in the foreground, and those others kind of fade into the background. Or maybe all I want to get across is the blurry meaning, and I want to put all the states on my chart, right? Is that too much? I see that the Tennessee teen birth rate line is going down. I have all the other states in the background. They're all going down pretty much. And I see that Tennessee is still, though it's decreasing, it's still probably in the top quartile. Right, but that's about all the meaning that I'm taking away from this. Each of these individual lines doesn't mean much at all to me, other than just providing background context. Right, so having all of these things, all of these lines, right, over 50 lines on one chart, it isn't necessarily a bad thing. It isn't necessarily a bad communication. Depends on what I'm trying to communicate. right? I mean, I like this, and I like using things like this. As I've mentioned a little bit earlier, we seek meanings and we make connections when we see something visually, when we see a chart. And once we see what stands out, we try to make sense of it and try to craft a narrative in our heads, right? This can be good or bad, right? It can be good because we process visual information thousands of times faster than we process text, right? If I have a text table with the average percent poverty for families in each state and the average teen birth rate, it's going to take people a long time to come up with any correlation that states with higher poverty have higher teen birth rates, states with lower poverty have lower teen birth rates. And when I put that in a picture, that gets processed much more quickly, and my audience starts to understand and starts to tell themselves a story in their minds about why these things are related, right? So that can be good and bad, because maybe they're telling themselves a story that I don't want them to tell themselves. And, you know, I've created a misleading communication inadvertently. Or maybe, you know, they're telling themselves a story that I do want them to tell. And they just get there much more quickly with the visual than they do with the table, the text in the table, right? And just like we saw with this one, we can easily tell ourselves a story about why these things are correlated, even if they're not really correlated. Another thing that I want to just point out, that when we see charts and graphs, we rely on conventions and metaphors to help us understand what we're seeing. Right, so what's this a picture of? Somebody tell me, what's this?
It's an upside down map of North America.
Yeah, it's North America. And what's wrong with it? What did you say?
It's upside down.
It's upside down. Yeah. So is this wrong? Is this not North America? Is this not the way North America looks? Chungmin says, no, it's not wrong. It's not wrong. Is it harder to figure out than if we saw it right side up? Is it harder to understand what this is? Yeah, probably so. Yeah, Nika says, I can still barely see it. It's definitely harder to understand. And that's because we have a convention that north is up and south is down. Right? It's not wrong. That's still North America. That's what North America looks like. So it's correct, but it's poor communication because it's hard for my audience to understand, because I'm not my audience is relying on this convention that north is up and south is down. And I am not playing in to that convention. Right, what about this? What's this graph of? Yeah, flipped axes, issues with the axes. Year to x-axis, please. Yeah. So we have a convention that year goes on the x-axis and goes from left to right, right? This should look like this. It's a chart that we just saw, right? But I put year on the y-axis, and not only is it on the y-axis, it's going from bottom to top, right? So it looks like, even if I turn my head and I'm looking at this, it looks like my trends are going up instead of going down, right? So it's not only backwards, within being backwards, it's backwards, right? It's nested backwards, right? When this is what we're used to seeing, because we have a convention that time is on the horizontal axis and goes from left to right. Right? This is really hard to make sense of because it's not what we're used to seeing. When this is much easier to make sense of. What about this? What does this mean? Yeah, it looks like a trend when it's not. Should be a bar chart. Separate categories shouldn't have a line. So does it look better like this? Is this easier to understand? Yeah, so much better, right? Technically, right, from a math standpoint, right, this isn't wrong. Just like technically, this isn't wrong, right? The data are put in the right place for the axes, right? The data are put in the right place, but we have a convention, and a good convention, that things that are linked in a line chart are directly related, almost always temporally related. Right? We use line charts for trends. Right? And so, when you see this, it's hard to figure out because it's not using a line chart right. The way we use them is for things that are directly related. All right, what about this? What does this mean? Agree or disagree, we have enough clinical capacity to meet our population needs. What percent of respondents agreed with this statement? Agreed or strongly agreed? %52%. Yeah, was that easy to figure out? Kind of easy. Was it harder than it should be to figure out? Yeah, they should be next to each other and they should be the same color, right? It's much harder than it should be. Is this a good data communication? No, we have a convention that similar colors go together, right? And the strongly agree and the agree should both be blue. The strongly agree should be darker blue, and it should be beside the lighter blue agree, right? But this hurts to look at. It's a pie chart. It should be simple, but it hurts me as somebody who cares about data communication. Yeah, ordinal scale color. Yep. Right, so these are just conventions that we have. North is up and south is down. Time is on the horizontal axis and goes from left to right. Things linked in a line chart are directly related, almost always temporally. Same colors go together, and that there's an ordinal gradient, right? If there's an ordinal gradient in the data. And all this stuff matters, right? If you're creating charts and graphs that don't use these conventions, or you're making them more confusing because you're putting too much in there and you have background peaks or background valleys or background crossing lines or things like that, it makes your charts harder to understand. Your audience tunes you out. It might miss your message, or they don't trust your information, or worse yet, they don't trust you, right? Maybe they think you're trying to be tricky. All that stuff matters. So to recap, the things that I said I was going to talk about today was thinking about things that we should consider before putting together our communication tools, how people receive new information, and then doing the communicating, right? Some things to think about when we're building tables and charts and graphs. So I hope that I've done that. I have another breakout room. I don't think that we have time for it, though I think it's really useful to talk and listen. So just, think about upcoming communication projects that you have coming up, talk to each other, get feedback. Let's do a big finish. When you're communicating, you have to be you. Right? You have to do it your way. Nobody is better at being you than you. Right? The way that I communicate, right? I try to do stupid little jokes, and sometimes I try to do stupid little jokes to lead into something serious, right? Like the lightning crash and people who know that statistic, the death rate is 1 in 6. But for real, that's serious, because the best case scenario when you miscommunicate is that you're giving people useless information. The worst case scenario, much more likely, people are making bad decisions and your programs are getting worse, right? So that's me. That's how I can be most effective. My boss, right, she speaks with such gravitas, right? She just has a way of presenting that people are just listening and they're captivated, and it's serious. I can't do it the way that she does it, because that's not me. If I try to do it the way that she does it, I'm just going to be a worse version of her. Right? So I've got to be me. I've got to do it my way. So be you. Nobody's better at it than you. Practice. You've got to practice communicating. If you don't have a lot of experience communicating with data, practice on your colleagues, practice on your pets, right? Practice to yourself, right? You've got to practice. It's hard to be just naturally good at it, and you're not going to be as good as you will be later with practice. Finding opportunities to give presentations, that'll make you a better communicator. But if you don't have a lot of experience, you get more comfortable, you build experience by practicing. Your professional credibility and reputation really matter. And being a good communicator will add to your credibility, will add to your reputation. These are major commodities for your career, right? Your reputation and your credibility. And as I said a couple of times already, I think that an epidemiologist that's twice the communicator and half the analyst is going to be much more effective than an epidemiologist that's twice the analyst and half the communicator. But when you're the communicator of data, when you know the data and you can present the data, that's a lot of influence. Right? I talked earlier about the power of using mixed methods and telling stories and using data. And you can use that to make things better. You can also use that to mislead. And you can be a very convincing misleader in that way. Your morals and ethics are so important. They're paramount as you increase your data communication skills. All right, and I think that that's so important that I'm going to end there. That's a picture of Claire and Clover, both looking for some food. All right. 5 minutes till. The baby and pig pictures, yeah. That's one of my things too. All right, so some questions coming in. Are there standard recommendations for usage of colors in reports? If people are colorblind, we need to change some combinations in preparing reports for to be accessible to the general public. Yeah, so there are definitely accessibility standards and standards to make things, whether people are colorblind or if somebody is just going to print on a black and white printer, right? That the way that you use colors, the way that you use shading, the way that you use patterns in your visualizations matter. And there are good recommendations for the way to do that. And some things get like put into programs like Tableau. If you're using Tableau for data visualization, if you're using Excel, right? They're getting much better at tools for how to build those. Yeah, Nika says Tableau has tons of free learning to help learn this. Yeah, LinkedIn Learning, there's a bunch of great stuff on data visualization. Yeah, there's so much information out there. And all of it is useful to make you a better communicator, especially communicating to people who aren't used to looking at data. Have a dark background and light text. Yeah. Yeah, I mean, look at my slides, right? All my slides I try to do this way, to have, you know, this dark background. I like this blue background with white text. So I like it. I think it's easier to follow when it's less distracting, I think. Cute babies and pigs. I hope that says cute babies. I hope you're not suggesting that I cut the babies and pigs. Oh, awesome. Thank you, Kwai. Yeah, they have colorblind mode. Awesome. Pat, something to share?
Yeah, I do. I think the American Evaluation Association has some great resources. One of them is called Potent Presentations Initiative, P2I. And, you know, as is typical of evaluators, they evaluate great presentations and not so great ones, and then they've summarized all their findings. So it's a whole set of resources, everything from how to design your slides to how to get really great quality photos, and then also how to create an interesting, engaging presentation, whether it's the 15-minute version or the longer version. So I strongly recommend, it does take time to go through that resource, but it will change your life. It will change your presentation life. But then the American Evaluation Association, and these are free resources, also has quite a bit on the best practices in data visualization.
Awesome, thank you. Yeah, there's so many good resources out there. You know, take advantage of all these resources. Folks are posting resources in the chat. That's wonderful. Again, my biggest thing is to think about this, right? To stop and recognize the value in thinking about the way that we're presenting and communicating. Oh, awesome, Kyle. Kyle put the link in the chat. Yeah, so other suggestions, if you have other suggestions, post them on Teams. You know, we all have access to Teams, so post your resources there. Again, what I want to stress is how important this is, right? And how important it is for your, you know, for your career potential, your professional development, your effectiveness. Other thoughts or comments as we wrap up? All right, Ashley, I'll throw it back to you. Thank you, everybody. I really appreciate you. And thanks for sharing all of your wonderful resources with each other.